A very good morning everyone. So today I will be presenting my journal titled Clinical and Microbiological Study on Local Application of an Ozonated Olive Oil Gel in the Periodontal Pockets, a randomized double-blinded trial. So this was published very recently in 22nd July 2025 in a Journal of Clinical Medicine, which has an impact factor of approximately 5.4. So the terminologies which we need to know before proceeding are SRK, scaling and root training, AOE, it is activated, ozonated, extra virgin olive oil. So it is a novel investigational gel. So the ozone is actually incorporated into it, and it is bubbled through the olive oil, which creates ozonoids and other compounds with antimicrobial and anti-inflammatory properties. So as usual, the periodontal indexes like the PPD, that is a probing pocket gap, the CR is a clinical attachment level, and the DOP leading on probing, and PI is plaque index. qPCR is quantitative real-time PCR, so it's a highly sensitive molecular technique. So the novelty of this study is it has a comprehensive approach where it combines a robust clinical trial design with advanced methods like qPCR. And it also focuses on a very specific formulation like that of this ozonated olive oil. So the brand which they've used is Ozone gel, and they've decided it for better bioadhesion and retention in the periodontal pocket when compared to other normal liquids or oil. And this study is also said to have this microbiological specificity, where it does not only mention the bacterial load like other studies do. So it also quantifies the reduction of the 6 specific high impact periodontal pathogens that are actinomyces accomitants, the Periodontal gingivalis, Treponema forsythia, Treponema denticola, and Fusobacterium nucleatum, and C. rectus. So this will give us a mechanical insight into the clinical improvements. So the aim of their study was to evaluate the clinical and microbiological efficacy of this novel gel as a topical adjunct to scaling and root planning therapies, which were done to treat the periodontal pockets. So the primary objective was to assess the change in the clinical attachment level. The secondary was to measure changes which are observed in the PPD, DOP is leading probing, PI is the plaque index, and all plus the load of all the 6 periodontal pathogens. Moving on to the materials and methodology. So it had the trial design was, it was single center randomized double blind placebo controlled parallel group clinical trial. So initially randomization was done. After that both the participants were double blinded, and the clinician performing the treatments, and it was all blinded, and the assessor and the operator were all blinded. So that is why it is double blinded. So this is what is essential to prevent the bias which is seen in the study. And then thirdly, we had this placebo control group. The use of a placebo gel was applied here. So and then they got the they got it registered in the ethical committee, in their review board, and that was the number. And so they had this robust selection of participants in the study. So the inclusion criteria, it focused on stage 2 to 4 periodontitis patients, that is moderate to severe basically. So it was categorized based on a 2017 classification. And then the disease activity was noted, that is if they were only included if they had periodontal pockets that too greater than or equal to 4 mm. And they also made sure that they have not been treated previously. And then their general health was also taken into account. So the exclusion criteria included patients who smoke and patients who has an intake of antibiotics or corticosteroids. They were not included in the study. And then patients who were allergic to certain drugs and were pregnant were also not included. So they proceeded to this intervention protocol, where the baseline standardization of all patients were done. And then after standardization, the scaling and root planning was all carried out using a combination of ultrasonic and hand instruments. So hand instruments, they use graciculates as usual. And then the gel application was done. This was basically the test. So the method blunt 23 gauge needle. To deliver the gel into the periodontal pockets, and then the teeth was all isolated, and they maintained strict sterilization and other protocols so that there were no any other issues noted, and post-operative care was also done. So clear instructions were given to the patients not to have any contact with that area of this experiment post 30 minutes study, and the outcome measurements are they calculated the PPD and the bleeding on probing and the plaque index, and post which the microbial parameters were all checked, and the sampling it was done using sterile paper points. They kept it in the periodontal pocket for 20 seconds, and that's where they collected the subgingival plaque, and then they proceeded with the quantitative qPCR, where they quantified all the pathogens, and then the blinding and randomization was done. So they performed this online random sequence generator, where it was done to prevent the selection bias. Then blinding was done. So the timeline, the study had a very clear timeline. So to perfectly assess the short term and the medium term effects. So they had a baseline where the day they performed the scaling root planning plus the gel application plus the clinical or microbial sampling which took place. So post 3 months they had this 3 months follow up where clinical assessment was only done, and 6 month follow up where clinical assessment plus microbial sampling was both done together, and this was considered to be the final assessment. So basically the baseline 3 months and 6 months were done. So they used numerous statistical analysis. Like they had a basic descriptive stats, mean and standard deviation. So within group comparisons like pair test and between group comparisons were done. Like independent t-test and man-Whitney U-test. Regression analysis was also done. So p-value less than 0.05 was considered to be significant. So also the clinical indices, like they showed significantly greater improvement in the oxygenated group at 3 months and 6 months respectively. And the microbial data, it showed significant reductions in the total bacterial growth. And all the 6 pathogens were also, the total load was also noted, but the placebo group, it showed no significant changes. So these were the results again. So it had significant results. So the 3rd month and the 6th month, it showed better changes in the oxygenated group, ozonated group. The microbial results also revealed the same. So reductions in those specific periodontal pathogens, the reduction was really dramatic. It ranged from 63.8% in case of actinomyces cognitive to 98.7% in Trachoma denticola. So it was all statistically significant, and no adverse effects were reported. Moving on to reduction. So the authors, they confirmed that there is logically a logical connect in a massive bacterial reduction to the clinical improvements that are seen. So that strongly suggests that there is a microbial shift which is observed towards a less pathogenic microbiota. So this also contextualized their findings with the existing literature, which cites that it supports the ozone's efficiency, and they also propose a plausible biological mechanism. So the oxidative properties of this ozone disruption, it disrupts the bacterial cells and it modulates the host's immune response. So that is, it reduces the pro-inflammatory cytokines. So the strength of this study, this is a RCT with double blinding. So it uses both the clinical and the advanced molecular techniques, and it has been standardized that it has a single operator for SRP and measurements. So it was all safe, and this study was very clinically relevant. The limitation is that it has a very small sample size. So that was a primary limitation. So also the threatening the statistical power which was seen and generalizability of the findings. Plus it had a short-term follow-up that is only for 6 months. So it is inadequate to claim a long-term efficacy from this 6 months alone. And this is a single-center trial, so it limits the external validity again. And then this study has lack of inflammatory markers like biomarkers like interleukins or matrix metalloproteins and in GCF, which is majorly said to study about the periodontal conditions, and plus this study had no patient-reported outcomes. So in the future, they can conduct a large-scale multi-center RCT, so which has a longer follow-up period, like 1 year or 2 years. So they can include analysis of inflammatory biomarkers like interleukins and matrix metalloproteins. They can take it into account and to corroborate the proposed anti-inflammatory mechanism. And they can compare this ozonized gel head-to-head with established adjuncts which are already seen in the market. And they can investigate the effect on the oral microbiome as a whole using this next-gen sequencing technique, so which can, from which we can study about the ecological shift which is happening. So to conclude, this study said that this ozonated gel plus scaling and root cleaning, it was significantly more effective than the normal scaling root cleaning plus the placebo. So it also stated that patients had they showed a clinical improvement. They showed a superior reduction in probing depth, clinical attachment loss, bleeding on probing, plaque index at both 3 and 6 months. So that it also had a microbiological impact. Plus the findings of this pilot data are promising, but it is more of a small short-term study. So therefore, larger trials are required to confirm these results. This study has followed the consort guidelines for the RCTs. The title, the introduction, the methods like the study design, the participants, the intervention methods, control outcomes, the microbiological techniques which were used, the timeline, they were all clear and well documented. The statistical tests, they have used appropriate tests, but still specific tests were not named. So that is said to be like partial. And then the bias control was all robust, and the results, data accessibility were all clear, and the discussion conclusion was all great. Plus the strengths, limitations and future direction was also implied in